Welcome to our continuous series of virtual voices focusing on the United Nations Sustainable Development Goals. Thank you for your letters and questions. We appreciate receiving them. Our speaker today is Mr. Chad McClennan, the President and Chief Executive at Koios Medical Incorporated, an NL software and life sciences company empowering physicians with clinically proven deep learning algorithms and decision support tools in the fight against diseases. Working with physicians from across the globe, his team at Koios Medical is helping facilitate early disease detection, saving lives and saving billions of wasteful overtreatment, thus elevating care and quality of life worldwide. A seasoned executive with a track record of working with leading technology and healthcare-focused organizations, Mr. McClennan recently delivered a TEDx talk discussing how machine learning is transforming radiology. He works closely with physicians, engineers, and healthcare leaders from Memorial Sloan Kettering to American Hospital in Dubai, and expanding the innovative capabilities of Koios in partnerships with companies such as GE, Fuji, and many others. Mr. McClennan received his Bachelor of Arts degree from Middlebury College and his Master's in Management from the Kellogg School of Management at Northwestern University. Over to you, Mr. McClennan.
Thank you so much, Dr. Dobak. It's just such a pleasure to be here. Thank you to everybody who's chosen to join today. Very excited to share what we're talking about with the World Information Transfer. The topic today is about advances in medical diagnosis. And we're going to move into a discussion that involves artificial intelligence and how the advancement of science and technology and medicine is converging, and a modality of ultrasound is elevating in terms of its ability to influence diagnostics and care. So when you think about medical diagnosis, there's a wide spectrum and breadth across the globe. Different diseases, different conditions, different parts of the human anatomy, applications to men, women, or both, and the ever important, accurate, and timely diagnosis that will lead to a proper treatment. So when we think about diagnosis, we think about healthcare. It's virtually infinite, the combinations. We're going to talk today specifically about the impact of diagnosis and a specific type of advancement in diagnosis. But first, we're going to go on a little swimming lesson. 30% of the world's data volume now is being generated by healthcare data. That's growing at an enormous rate. Every day, mounds of information are being generated and created. There's a prediction that by 2020, just last year, that there were 2,000 exabytes of healthcare data. And I'll bet most people don't know what an exabyte is. An exabyte is 1 billion gigabytes. In other words, we're swimming in data. We are immersed in data. From patient reports to medical records to billing to imaging data. Imaging data is the majority of much of this information. And that's growing with wearables, with telehealth, with data about pharmaceuticals and devices. But that swimming lesson is not without risk. Among all of that data are issues with data accuracy and bias and noise. So as much as we know that there's this immense amount of data, to ensure that we have the proper data and accurate data is imperative, because that data will ultimately inform decision-making. The focus of this talk will be specifically related to imaging and imaging data and the data that goes into and comes out of patient reports. Some of you might be familiar with the data continuum. At the base of this continuum is this raw data, structured and unstructured data from all of the different sources that I just referenced. Combining that data creates information. We talk about being in the information age. When we're in the information age, people become knowledgeable or knowledge workers. That progression and advancement of this continuum of elevating data to information that becomes knowledge also then ultimately becomes wisdom. We want to be as wise as we can possibly be by leveraging the data, converting it into information so that we are all more knowledgeable and we can make the wisest decisions possible. Some of you may have seen this continuum adapted, where the top and the pinnacle of this isn't just wisdom, but power. It's powerful to be informed. It's powerful to be able to influence diagnostics and treatment using data. Data has been termed or coined as the new oil. It's within these reserves, within healthcare institutions, flowing, but not always easy to access. How do you extract that data? How do you refine that data and make it usable? It's been described as the data that feeds artificial intelligence is the new form of alchemy. Is there really gold in that data? Can that data be manipulated to create immense value? Algorithms are being described as the new drugs. Artificial intelligence is a combination, it's a field where algorithms, machine learning, deep learning is becoming powerful tools in healthcare. They're regulated similarly the way the drugs are regulated. Technologies must get clearance or approval from the FDA in the US, must get CE marks across Europe, and other regulatory bodies from Japan to the Far East. But those algorithms that begin with that data are setting the stage for augmented intelligence, not artificial. There's nothing artificial about it when it's impacting lives. It's augmenting the intelligence of physicians, decision makers, that allow for enhanced potential diagnosis and treatment. So knowing this, knowing the context of the existence of this data, the potential for algorithms to augment intelligence, it's really important that it be directed at a problem, not just nice to have, but need to have applications. A big problem is a global breast cancer epidemic. We're within Breast Cancer Awareness Month. And it's scary to know that breast cancer has surpassed lung cancer as the most commonly diagnosed cancer on the planet. 2.3 million women annually, and about 1% of those are men. Something that we don't fully understand is why are cases going up? Why is incidence increasing? Certain parts of the world, it's expected to double in the next 15 years, and we don't know why. What we also know is based on the human anatomy and the differences in people based on ethnicity and other reasons, that certain women have a higher risk factor. Breast tissue density increases the likelihood of contracting breast cancer. And the commonly prescribed screening using mammography or x-rays is insufficient and oftentimes ineffective. A woman goes in for a routine mammogram or chooses not to because of her breast density. Cancer appears white on an x-ray. Dense tissue appears white. It's often described as finding the proverbial polar bear in a blizzard. And when it's found, it's oftentimes found too late. So we were thinking about ways to use this technology, AI and data, to attack a global problem. But not just that one problem. There are related downstream problems. We're human. Humans make mistakes. And when it's your mother, your wife, your daughter, friend, or family member, it can be life impacting. Johns Hopkins studied that the medical errors are the third leading cause of death in the United States. 130,000 missed breast cancers in the US every year. COVID has had a profound impact on our clinical workforce. A recent study just came out the other day that 22% of the radiologists in the US are considering leaving the field. They're burnt out, they're overworked, they're expected to do more with less. Med student applications are down. And the socioeconomic impact of late-stage breast cancer is in the billions. Not to mention the life years lost. We've all heard most men will die with prostate cancer, not from prostate cancer. But a woman in her 30s, 40s, with a family, those children won't have a mother. So what happens every day in reading rooms around the world? Phenomenally bright, talented people stare at screens, trying to make the most of what they're seeing, which is often a life and death decision. And it's repeated over and over with a limited amount of time and scarce resources. I sit in those reading rooms and watch and observe what they do. And our eyes can play tricks on us. They see different things. In this image, until I point out to you the object within the bricks, it's invisible. What looks like a chihuahua might be a blueberry muffin. So massive data sets are compiled that can often be confusing, with patterns invisible to the human eye. That with the advent and the use of machine learning and data, we can now start building models, deep learning models that analyze features that are invisible to the human eye, patterns at a pixel level that can tell you whether something is benign, suspicious, or malignant. So we chose that big problem of the spectrum of cancer. Breast cancer and thyroid cancer. Two cancers that use ultrasound as an imaging modality to diagnose and lead to the most effective treatment. And we're talking massive amounts of data. Hundreds of thousands of medical images that will soon be in the millions, all tied to their pathology. The machine needs to know what it's seeing so it can give you an accurate determination. Why ultrasound images, you ask? There's MRI, super high resolution. There's CT scans. There's X-ray and there's mammography. Ultrasound is the most widely available and most accessible modality. Also happens to be the lowest cost. Safest, it's sound waves. No radiation. No injected contrast material. It's portable, versatile. Came to the rescue in COVID at point of care to do chest x-rays. It happens to see cancer in dense tissue that's invisible in a mammogram. These are relatively small files. We can move them around quickly, unlike other modalities. The clinical pathway for breast cancer starts with the millions of women. But our ability to now use this data creates this impact zone to reduce false positives and catch cancer earlier. It's in the reading room now, no longer just in the lab. Physicians pull up images. We help them identify using data what's suspicious, what's abnormal. Then we help them take a closer look. We have it described as a digital biopsy. Before taking a tissue sample, which leads to scarring, leads to infection, leads to complications, leads to stress. In many parts of the world, it can be weeks, if not months, before something suspicious is referred to the proper treatment. Within seconds, a rendering of an analysis that doctors call a digital biopsy can provide a result. Benign, probably benign, suspicious or malignant. With the confidence that the system has in that accuracy, and it aligns to rating systems around the world. In the US and other parts of the world, we have what's called BIRADS. There's a European classification scheme of a U1 through 5. So we take the data, convert it, and map it to that lexicon. Why is this so important? I told you, the missed cancers, high false positive rates, unnecessary follow-up, people coming back getting consultations that are unnecessary and avoidable. Also, one of the issues in diagnostics is you go out to get a second opinion, a third opinion. The variability is the enemy of quality, quoting Deming. Radiologists will disagree with each other a significant portion of the time when looking at the same image. I come from a radiology background. My father is a radiologist. He was a chairman of a department for 20 years. And what I would tell him is there's the same question or joke. How many, in a room of radiologists, 5 or 6, how many opinions? 5 or 6. They will disagree with themselves. The same radiologist we will test, given the same image a month later, 20% of the time, a different diagnosis. So this AI is no longer in a laboratory. It's no longer in an academic institution. It's now there embedded in the clinical workflow. We started on this journey back in 2012, compiling data, spent years doing modeling. Now we do automatic segmentation, classification, characterization, feature descriptions, all leading up to enabling the proper treatment directly on a scanner or integrated into a PACS, the picture archiving and communication systems that stores these images. And it can go right into a patient's report. So what does that look like on a scanner? It's embedded at point of care. It can be used right there in the reading room to speed the diagnosis and treatment of a patient. It's also available on a whole breast ultrasound system. It's been developed to work with the array of browsers, the workstations that are in reading rooms and exam rooms across the world. A single button allows the ability to analyze those lesions in real time, on demand. How accurate is it, people want to know? What is the clinical evidence that supports this? Multiple studies have been performed, hundreds and hundreds of cases, dozens of physicians, proving the effectiveness and accuracy of this technology. And we have a library of evidence that's building. For every 10,000 cases analyzed, physicians with the support of AI as decision support can find 26 more cancers sooner, while simultaneously reducing the number of biopsies ordered in excess of 400. In US dollars, the savings exceed $5 million. And we're giving them back time, precious time, to focus on their patients and delivering the highest possible quality of care. Other things that have been used AI during COVID, the women and men who avoided care, the millions of backlogged, suspicious exams. We have hospitals using the software to go into those records, to those images, scan them using AI, and find more cancers, while also downgrading the risk of suspicious lesions. Multiple studies from NYU to Yale, research partners around the world, here in the US and in Europe and in the Middle East. But what do doctors have to say about it? It's pretty impressive when you're in the reading room and you watch a physician catch a cancer. When they say it's amazing, it's the best thing for their patients, and it has a significant impact on their practice. They find it incredibly useful. This isn't just happening in radiology. It's in endocrinology. It's in cardiology. AI is a new evolution in diagnostics. When we hear about and talk about precision medicine, this is all massive amounts of data being refined to be used to elevate the quality of care across the spectrum of healthcare diagnostics. Where is this happening? Just this one small technology, decision support for ultrasound, is now taking foothold across the world. We anticipate 20 different countries between now and the end of the year, growing fairly rapidly. The adoption's been phenomenal. Clinicians around the world are understanding that AI is an asset and a resource. It's penetrated our daily lives, from how we get from point A to point B using different mapping tools, and it assists in rendering an accurate diagnosis. Let me just stress the impact that this has on lives. The more cancers found early, the fewer missed cancers, and the lives impacted. The fewer biopsies that leave scars, risk of complication, that deter women from seeking care in the future. The spend, the interpretation time, the return to payers and risk holders is massive. And it's also an immeasurable socioeconomic benefit and value. I'm going to take a chance here on some audio.
At Koios Medical, we are always asking ourselves, what is possible? Instead of catching suspicious criminals, what if we could catch suspicious tissue? What if we could accurately classify those lesions or nodules as benign or malignant, getting to the answer quickly, saving precious time? Today, our software is doing just that for physicians who have joined us in the battle against cancer worldwide.
Artificial intelligence is important to use in conjunction with ultrasound, especially when you're looking for cancers in dense breast tissue, which can be hard to detect. There's a new lesion in the right breast. It looks pretty benign, but let me get the second look. In between, or the tiny ones, even down to a few millimeters that we can't always assess easily. That's where I think AI technology really helps. Oh, and it says BI-RADS 2, what I thought, so just a benign lesion. It's a second look to give me the confidence that I need to make that final decision. We did see a new mass in the right breast. But when I looked at it very closely and ran it through our digital biopsy, everything is normal, okay? There's nothing to worry about.
Well, thank you. Wanted to close with that vignette because that's literally what we see happening day in and day out when folks are enabled with augmented intelligence sourced from hundreds of thousands of images from 48 sites around the globe and making an impact in the lives of people every day. With that, I'll pause. Field any questions. Back to you, Dr. Durback.
Thank you very, very much, Chad. That was an excellent presentation, and hopefully the smart ultrasound will expand rapidly globally all over the world. We have a lot of questions, and Jessica, over to you, Jessica.
Yes, hello. Thank you for a very interesting presentation. Our first question is from one of our students. And she would like to know, when do you think that third world countries such as Ukraine will start using artificial intelligence to study cancer? And will this happen given at all the economic development in these countries?
Sure. Well, I can't speak specifically for the Ukraine. I would be surprised if they're not already experimenting. The adoption and the modeling is really growing quickly. Oftentimes it's in some major academic medical centers are experimenting with publicly available data sets. In terms of commercial availability, I think that's probably something you could find in the public domain as to what's been cleared and what's approved. You'll look for who has CE marks. And our software, in fact, is cleared and approved for use. It just requires physicians to advocate for and sponsor the use of the software.
Fantastic. Our next question is from Sophia. They would like to know what are the cases, if any, when your artificial intelligence technology detected false positive or false negative results?
Sure, that always depends on the data set. Our false negative rate significantly exceeds that of humans. For every 100 or so cases we see of cancer, we accurately diagnose 98 to 99%. The ones that are tricky, we have in the lab. Oftentimes they're described as a triple negative cancer. And we have amassed triple negative cancers, and we're constantly training the system to try to get and be more accurate. It's a risk prediction based on just the image itself. With physicians, it can be even more accurate because what the physician knows is that patient history. It also has a bias for being conservative. So when we recommend that a biopsy be performed, we're still going to have a false positive rate, but it's going to be closer to 40%, not 80%. Because any human plus human machine, it's much more important to not miss a cancer than it is to perform a diagnostic procedure.
Thank you. Our next question is from Darna. They would like to know, does your knowledge of art help you to look creatively at work questions or solutions to problems?
Does the knowledge of art? I think there's absolutely the element of art and creativity, if that's what the question is, that's really imperative. When we focused on just being exclusively software, the design of the user interface, the creativity about everything, just the black background, if you notice that, you can't develop a software that has a white background like this for a physician who's sitting in a dark room. It would be blinding. So there's definitely advantages to a creative element applied to software user interface design and user experience.
Great. Our next question is, how can we effectively control the appearance of cancer cells in any part of the body to start treatment on time?
So, the only thing that we can suggest, and what's great about what we build into the software, is oftentimes it's a mass that's found through a self-exam, a palpable mass. And the earlier you catch it is through screening and being very educated and aware about your own personal anatomy, your own density. So the sooner you can be screened with ultrasound in addition to mammography, the sooner you can find that tissue early and have a dramatically improved survival rate and fewer treatment issues and complexity.
Thank you. Our next question is from Julia. She would like to know, she says, the internet often writes about the importance of cancer screening. What tests should men and women undergo, and at what age?
Sure. If you go to the various cancer.org, et cetera, it's typically recommended that women get annual screening mammograms at 40. There's debates in terms of whether it's 40, 45, 50, and it actually varies even here in the US with different states and different coverages. But clearly there's benefits proven in the literature that screening starting at 40, especially if you have a family history, but also in that initial screen, you should be very clear on understanding what your personal risk factors are, and the density of your breast tissue is an important one to understand, so you can seek supplemental screening with either ultrasound or MRI.
Thank you. Our next question is from one of our students. They would like to know, is there a prevention of cancer?
We all wish we could know. There's, again, in the literature, the prevention is really avoiding those things that have been shown to increase the likelihood and incidence of cancer. So lifestyle, stress, diet, et cetera, exercise, there's no sure thing, but certainly the healthier habits that we all have, we put ourselves and position ourselves to be, much more favorably than otherwise.
Thank you. Our next question is, what do you think the treatments will be for cancer in the future?
Well, I certainly hope that a lot of the amazing work that's being done, genetic testing, stem cells, just there's a whole host of adjuvant therapies. And one of the things that we look to do is be more intelligent about the diagnosis to better inform the treatment. As you know, the treatments right now are radiation, chemotherapy, and to be able to be more precise with the right treatment for the right type of patient at the right time for the right type of cancer. Not all cancers are the same. So when someone is diagnosed with a cancer, there's DCIS, ductal carcinoma in situ, right? That's not yet an invasive cancer. There's a specific treatment for that. Then there's obviously later stage cancer, there's metastasized cancer, there's different types. I mentioned triple negative cancers. So it really depends on the cancer, but there's a tremendous amount of amazing research going on to help make those treatments much more effective, much more precise, reduce the complications and side effects, and increase survivability.
Thank you. Our next question is there a protection against hacking of your computer programs?
A great question. We take immense precautions. The software, for example, is not a cloud-based software. It's sitting on-premise within a hospital system, behind the secure firewalls. We're constantly communicating with the system to ensure that it remains secure. But certainly that's clearly something that our cybersecurity experts, and working in conjunction with the cybersecurity experts of our installed base customers, oftentimes that's more of a hurdle and makes the implementation more complex than simply training the physicians on how to use it.
Great. Our next viewer would like to know, what do you think of people diagnosing themselves on the internet?
Well, again, I talked about data becomes information, becomes knowledge, and becomes power, right? So there's a tremendous amount of information to raise your education level, to raise your awareness. So encourage seeking information from reliable sources, right? But then also complementing it with clinical professionals who've spent their careers and are trained. So it's not the answer, it's an answer, and it's an incredibly valuable resource. I encourage everyone to take ownership of their own personal health, to be an advocate for your health, to seek that second or third opinion, and do it from the best trained physician that you can have access to. AI creates that second opinion. We talk about how this technology bridges the health equity and disparities because there's a wide range of skill level. There's a wide range of experience across the globe, but augmented with intelligence that is consistently accurate. Every physician can perform as well as the best physician. And I tell even the best physicians, we can help you be as good today as you are every day on your best day.
Right, thank you. Our next question has to do with the rights of drug companies consulting patients on the phone. What are the ethical dilemmas and legal rights of drug companies to do this?
Outside of my area of expertise, so I'm going to have to defer on that one.
Okay. Our next question, our next viewer would like to know, can artificial intelligence replace human doctors in terms of diagnoses?
You know, there's a famous quote. I don't know if you remember back in 2016, Geoffrey Hinton, University of Toronto, working for Google, made the prediction. He said in 5 years, stop training radiologists. We don't need radiologists. AI will be able to more accurately and more quickly diagnose. About a year later, a gentleman by the name of Kurt Langlotz, he leads the AI Center at Stanford, modified that and gave us his interpretation that said the radiologists using AI will replace the radiologists who don't. Our software is a second opinion decision support that used in conjunction with a trained physician is incredibly accurate. But that physician brings context. that physician brings a knowledge of the patient that a machine does not have. The machine doesn't have the patient's history, doesn't have the mammogram, doesn't have other biomarkers and indicators. So the person plus the machine consistently outperforms the person, and we have yet to consistently feel comfortable allowing the machine alone. There are some applications that are just doing detection, that are automated detection, but ours is being very, the diagnostic aspect, we feel very comfortable doing that in partnership with physicians. Now in locations where there are no physicians, where it's an aide, where it's a tech, it's a nurse, right? Absent an alternative, the AI can be profoundly impactful in helping triage and getting that patient to care. We're in a clinic in South Africa, it's 8 hours. So to get the right person to care at the right time is clearly something that AI can assist with.
Great, thank you. Our next question is, how has COVID-19 affected the development of artificial intelligence?
So it's been a pretty profound impact in that access has been very challenging. So women have not been seeking care. So we saw 90% reductions in women coming in for their routine screening. 10 to 12% of those women will have something suspicious. So those women are out there among the population with a ticking time bomb, with disease that will be late stage disease by the time it's found. So the advancement of AI was slowed down just because the whole entire system slowed down. Our development was able to move forward because our engineers can develop anywhere. We could acquire data. But we're doing this to be a solution for physicians. And when people aren't seeking care, they're not getting that second opinion that they need to get the most early, most accurate diagnosis.
Our next question is, do you think, is there a chance early diagnosis side of completely overcoming cancer with AI?
So the diagnosis, unfortunately, it doesn't prevent cancer. It prevents the advancement of cancer. So in waging this battle, we don't know when a cell decides to become a radical cell. Normal cell, all of a sudden, someday something changes. And we want to be able to be there right away and know about it right away. So there's now blood tests for determining whether or not there's cancer cells in a human. We don't know where it is. So we have to work with those complementary technologies. But the other things that we talked about earlier in terms of those things that are known to reduce your likelihood of getting cancer, your diet, your habits, those things are really important. But in terms of eradicating, I hope there's other brilliant people working on that. We just want to be able to nip it in the bud.
Great, thank you. Our next viewer would like to know if you have an insight on whether or not the research in the field of cancer-causing mutations affects the quality of treatment.
And again, I don't think I'm versed enough to be able to say. What I do know is that what we're doing is we're trying to analyze patterns at a pixel level based on different types of cancers that might guide one treatment over another, which is proven to be effective. So we're working backwards and reverse engineering into the diagnostics. Maybe there's markers, maybe there's indicators. Maybe it's the tissue around the lesion that might be informative to whatever the prescribed treatment is.
Thank you. Our next question is, in what countries is advanced cancer detection technology available today?
Ooh, I'd have to go back to my list. Obviously we're in about 30 locations in the US. We have multiple deployments across the Middle East, Dubai, Saudi, Qatar, Spain, France, Moldova. We are in multiple countries in South America. So come to our website, we'll start pushing out where we are as physicians adopt. Tremendous responses from Europe. I was over in Barcelona, Madrid, Mallorca, and there's just so much awareness about AI, preparedness for AI. They said, we've known you're coming, we just didn't know when. And the reception, the clinical reception has been phenomenal. They know that the help is there. It's you know, they all took this oath. They want to do the best thing for their patient. And now they have another weapon in their arsenal to detect cancer more accurately and earlier.
Fantastic. Our next question is, what are the future projects to improve the technology of diagnosis in some other diseases?
Great question. We actually have a version for thyroid cancer, head and neck. It's growing rapidly. We don't know why. If anybody's ever had a biopsy of a thyroid, that's not a pleasant experience. And we can improve cancer detection, double-digit improvements. Physicians using our software are 13% more accurate. That's a big number, while simultaneously reducing benign biopsies for head and neck for thyroid cancer. It reduces interpretation time. So we're pending clearance with the FDA right now, expecting sometime for European clearance next year. We also have experiments going on with lymph nodes, expressions of interest from the medical community for liver cancer as well as ovarian. So the implications on AI with ultrasound to create smart ultrasound doesn't stop at the breast, doesn't stop at the neck.
What is required to clear FDA clearance?
A lot of time and money. Yeah, a lot of data, as I mentioned, right? Not just any data. You have to demonstrate that your data is sourced from across a wide spectrum of hardware platforms. So it can't be just built on a GE machine or a Philips machine. It has to be representative and demonstrate that it's generalizable across different ethnicities. So you need to make sure that that's a very diverse data set. You need to run clinical trials. We run trials where we have 15 physicians analyzing 900 cases twice. That's 1,800 cases read twice, comparing how well the physician performed without AI to how well that physician performed with AI. You have to demonstrate the age range and experience of those physicians so that you're not just getting inexperienced physicians and inflating the performance of your software. So we try to get more experienced physicians. So while it might depress the performance, if it's still helping the most experienced physicians, we believe that that makes it much more compelling to the broad array of physicians around the world. You then have to have a whole host of other requirements met. That the FDA is great in helping guide us through the process, because I truly believe the FDA, while it's difficult and challenging, makes us better, makes us safer, makes us more effective, makes us prove what it is we say we can do. So without them, it would be a much more worrisome situation. But we're a regulated software as a medical device, and we work closely with the FDA as well as our notified body in Europe for CE marks.
Fantastic, thank you. Our next question is, has COVID-19 detection technology improved since the pandemic? Is there a way to detect COVID-19 through AI?
Yeah, actually, there were some models that started with some folks in Italy. So point of care ultrasound, if you're following, they were typically taking a COVID-19 patient, going in for a chest x-ray or oftentimes a CT scan. If you're familiar with a CT scan is, it's the big donut machine. They call it the donut of truth, right? You wheel you in there. Well, if that person is contagious, you've got issues with moving the patients around the hospital. So all of a sudden they said, you know what? Point of care ultrasound might be a way to analyze lungs and use AI to help determine what's going on in that patient. Is it pneumonia? Is it COVID? Is it some other condition? So we had to get very resourceful, and ultrasound became a very safe modality that could go to the patient instead of having to transport the patient.
Fantastic, thank you. Our next question is In your opinion, will artificial intelligence be able to perform medical operations instead of humans in the future?
Perform what?
Medical operations instead of humans in the future?
Well, in the area of robotics, there's a tremendous amount of technology and advancement going on. So I wouldn't be surprised. I tell folks an article that I read, I asked them, when was the last time they were on an airplane? And do they know the average number of minutes the pilot was actually flying the plane? 7 minutes at the time when it's needed most. We want the pilot up there, but the human plus the machine, whether it's in surgery, whether it's in diagnostics, is proving to become a very effective partnership enabled by AI.
Fantastic. Our next question is, are you working on creating any new technologies right now?
Well, what I mentioned is the different indications, right? The different applications for the technology across the human anatomy. I say from nose to toes, right? Ultrasound doesn't penetrate the skull, right? But down, across the human condition, there's opportunities to use sound waves to look inside and be much more informed about what you're seeing. Less exploratory surgery, more timely diagnosis. But we also can look longitudinally. So we can use AI and we can use technology to reach back into that patient's history, and we can pull information forward. So if an image was found a year ago, 2 years ago, or 3 years ago, right, a radiologist says the prior is your friend. So was that lesion, was that nodule stable, or has it changed? So that's not nearly as sophisticated as AI doing the diagnosis, but it's complementing AI with a deeper understanding of the patient.
Fantastic, thank you. That is the end of our questions. Thank you so much for a very informative.
Jessica, you have forgotten quite a few questions. So the first question is, and that's from our other section. How does research in the field of cancer causing mutations affect the quality of treatment using the ultrasounds?
I'm not quite sure. Well, using ultrasound, one of the things that we use ultrasound for in treatment is when someone's getting treatment, they'll go back in and they'll scan the patient to see if in fact anything is advanced. But in terms of using ultrasound to treat, it's just trying to monitor the efficacy of a treatment to see if maybe another cancer has emerged. It's kind of a predecessor to pathology, so they don't have to go in and do anything that's invasive. But we're not personally involved in the treatment yet, although some of the things that I mentioned earlier relate to how we might be able to better inform treatment based on what we're seeing.
Thank you. Another question is, what is the best way to effectively control the appearance of the cancer cells in the body during the ultrasound?
So it's not as much the cancer cells, it's in an ultrasound. When you're in an MRI machine, they say lay still. When you're in a CT scan, lay still. Ultrasound is most often a handheld manual image acquisition. So it's really important that the technologist or the physician understand exactly how to best use the device to make the most effective diagnosis. And the example I use is if there's anybody here who's posting photos on social media, on Instagram, you might take a dozen photos. How do you decide which one you're going to post? Ultrasound, you might have what's called a cine loop. You might have a video that goes from one end of a suspicious area to the other end. You freeze it, you stop. What is it that's the most definitive in terms of the anatomy that can then be used for AI? Because it's a garbage in, garbage out. Bad images coming into the system is not going to generate an accurate output.
Interesting. Well, that's very true, but this fits into the next question. What are the future projects to improve your technology in diagnosis in the most complicated areas of health and research?
Yeah, so I think that the more complicated they are, the more excited we are because we think we can help the most. That being said, the more complicated it is, the likelihood of something that's profound goes down dramatically. So for example, pancreatic cancer, right? By the time people find out, it's too late. Is there any opportunity to be using imaging earlier on to have a much earlier diagnosis in pancreas, liver cancer, prostate cancer? The prostate cancer is is a different diagnostic form of ultrasound. We've worked with some samples of data in partnership with some diagnostic image acquisition companies. Ovarian cancer is I think a high potential impact area, but maybe it might be a combination of, it might be fusing intelligence that's taken from one modality, say for example, an X-ray or a mammogram or a CT scan, then merged with the intelligence that you get from an AI image. So that might be the stuff that's much more complex, but that would be multi-modality rather than right now what we're doing, which is ultrasound specific.
And this question is, could you explain a little further how the COVID-19 detection technology helped with the diagnosis?
So what helped in COVID was when handheld ultrasound was used in the ED and used in the ICU. And they were able to understand patterns and lines in lungs on ultrasound and then be able to correlate that. So you could see and start tracking progression of the disease and then also the recovery of the patient. So it's called broken glass. It's different ways that a lung that was infected with COVID would present in an image versus a healthy lung or versus a tuberculosis or a pneumonia. So it really became instrumental in helping triage patients, track recovery, who's improving versus who needs, escalated care.
This is very, very important. And actually, this question has to do with, to what extent are the medical technologies and advances in ultrasound utilized effectively, and in what parts of the world?
Sure. I'm super excited because what we're riding alongside the advances in ultrasound technology. And there's a tremendous amount of advancement. The physics of ultrasound, the math is just getting much more effective. It almost looks real. They almost make ultrasound animation come to life. And so what that ends up doing is it reduces that variability on what someone is seeing. So it makes our system able to be that much smarter as ultrasound machines themselves get smarter. So we work closely with those engineers so that we're the AI on top of it. We've all heard about Intel Inside, the big ad campaign for chips in computers. GE has an ultrasound machine that they say is powered by Koios. It's the breast assistant powered by Koios. I showed you on the screen, there's our little owl logo is directly on the console.
Yes, I noticed that owl. So I found it very, very interesting. And this question fits into this, and this will be our last question for the time, is how long do you think it would take for artificial intelligence to replace human doctors in terms of diagnosis? You must have thought about that.
I really hope that we never fully replace, right? I want to be able to say that AI is taking the work off of their plate that is basic, it's routine, and allowing them to be focused on the most complex problems, allowing them to get out of the reading room into the exam room, spending time with patients, right? So that combination of human plus machine enables enhanced access to care, elevated quality, and it's truly a partnership. Just as I used the example, the airline, we want the pilot up there. We feel confident. Our tagline is "Be Koios Confident," but I think the machine has a tremendous opportunity to make physicians more focused on the areas where we need them the most, and let the machine take over a lot of the routine stuff.
Well, thank you very, very much. Those were really very excellent suggestions. Since I was involved in the first time that they used a robot for knee surgery, I know to what extent the robots can be even more effective than the human hand. Now, there are exceptions. Some doctors are phenomenal, so we know that. But that is the marriage between ultrasound and the robots should really expand our medical profession tremendously and allow for a lot more cures and a lot more progress than we have so far. So thank you very, very much for your presentation. It was very educational, and hopefully most of our audience, I'm sure that you learned a great deal. It will also be on a webinar in a short time so that many people will be able to see it.
Great.
I just want to mention the next two webinars, November 3rd and 10th, will be held in Glasgow, Scotland during the United Nations COP26. The host and moderator will be Apar Gupta, who is the member of our board of directors. So thank you again and have a very, very good day. Bye-bye.
Take care. Thank you.